I'm Dr. Scott Fuller, and this is Health Source. I'm going to be talking again about health reform, health insurance reform, and job creation. I've talked about this in a prior show, but I'm going to add funding to this time. So this is going to also go out to my governor of Massachusetts, Governor Deval Patrick. This is going to go to the president. This is going to go to my national congressman and my state representatives and senators as well, because I'm going to talk about job creation and improving health. I'm going to lay out a program here on how we can actually save money on medical insurance, get everyone insured, and actually have a healthier population. So follow along. This is my program, and of course I'm glad to have all the help that we can possibly have to make this type of program work. So just as a quick summary, this is what we're going to be talking about: health reform and job creation. I'm going to talk about prevention, which is something that's not talked about on the health insurance reform, health reform debates right now. We hear very little about prevention. I'm going to actually make that a focus. I'm going to show you how we can save money. I'm going to talk definitely in this show how we're going to fund the program that I suggest, and we're going to talk about job creation, so we can actually piece this all together and save the nation's healthcare system. We can do this, and I'm going to add chiropractic at the end as well. So let me bring you up to speed first on a little bit of history on what developed this particular program. Back in 2008, right now it's December of 2009. So back in 2008, I did a show on the Life Sciences Bill in Massachusetts. It was signed into law by Governor Deval Patrick. It was $1 billion a year, $1 billion over 10 years. So $100 million a year was towards the life sciences. And that sounds well and good on the outset, but here's the problem. It basically is a drug bill. It's a drug research bill. And if you think that we need more drugs for more health, then this show probably is not for you. But I think most people agree that we don't need more drugs. We need more health. So what I did is I proposed a different suggestion for the life sciences money, this $1 billion in Massachusetts. And what I said is we're going to set up these community centers, and we're going to teach people how to shop for healthy food, how to prepare healthy meals for their family very quickly, and then have exercise programs available at these clinics 7 days a week, 365 days a year, in all the communities around the state. And we would take that $1 billion and feed it into that. Now, I'm not saying to ignore research and ignore drug research and genetic research and things like that, but I figured that this was a better way of spending our money, spending that $1 billion. So I put that vote in, I sent this program to the governor, I sent it to my state representatives and senators in the area, and I heard some replies. So $500 million of this $1 billion was for infrastructure improvements. You're going to see with my proposal here, we do not need any additional infrastructure. So we can save a lot of money and put it right into the programs. You see, $250 million of that was tax credits for companies, and $250 million was grants. The problem I saw with this program, as you can see as I spin it into the national healthcare debate and health insurance reform, etc., is it really wasn't for life science. It was more for drug research. There was nothing healthy about giving money to a company to research better pharmaceuticals and drugs and things like that, where we know that the heart disease issues and the cancer issues and the diabetes problems and the obesity crisis that we have is because we're eating bad things and not exercising. Eating bad things and not exercising. There's not a genetic epidemic of obesity in this country. Genetics do not explain it. What explains it is bad habits. So I said, let's take this money and put it into educating and helping people. Taking that idea of the life sciences money and diverting it into a clinic situation that would create jobs, because now we need to supply these clinics with people that can show the citizens how to shop with the same amount of money and food stamps. I'm going to wrap that into this as well. We're going to take that money and have classes, ongoing classes, maybe after school hours, and teach people how to shop, how to cook, and then exercise programs for any ability. Now that would create jobs for exercise. We would need personal trainers and exercise physiologists and people that would conduct these classes, because we would have a varied array of people in different physical health and needs, so we would have to have different classes available depending on their abilities at that time. You see how that works? That's part of the history. Now, the week of December 7th, as we're taping this right now in December of 2009, just this week in the news, President Obama was meeting with congressional leaders about job creation and adding new federal stimulus money to create jobs in this country. Well, here's the answer, President Obama. Here's my answer to my Congress people from Massachusetts. Here is my proposal to the state of Massachusetts as well, and to the nation, of how to take any new federal stimulus money and put it into this program right here. We're going to divert that money into job creation, decreasing healthcare costs, and helping prevent disease. Massachusetts, in particular, has a budget shortfall. So what I propose, as we're taking federal stimulus money from the federal government, pumping it into Massachusetts, we're going to divert some of the Massachusetts Life Sciences Bill funding into this program, and then any federal stimulus money coming into Massachusetts and any state will also fund this particular program. Recently in the news, some federal stimulus money was released at $600 million worth. $80 million came to Massachusetts to fund 8 community health centers, to boost up these community health centers in lower served cities and towns. Of course, that's a great idea. But then I thought, what if another additional $80 million came into the state from federal stimulus money, and we could pump it into this program? So you can see that this is very newsworthy right now. More federal stimulus is going to be coming out. Everybody's talking about job creation to help stimulate the economy in this country. Everybody's talking about the overpriced healthcare system that we have, and we need to save money there. We're talking about how many people are uninsured or underinsured when it comes to medical insurance, and that's what we need to talk about in this program. Imagine what we could do with all of this additional money, and that's what my program is based on. Okay, here's the program. The first step, we need to talk about prevention. Prevention is the key. We know that, and I'm going to talk about these 4 disorders: heart disease, cancer, diabetes, and obesity. There are many, many other diseases that would be related to this, but if we just talk about those 4, because those consume so many healthcare dollars, that if we can begin chipping away at the numbers of people that will get these diseases, or take the people that have these diseases and see them reversed, we're going to save billions of dollars over the next 10 years. Remember that the projection, if we take on what's going to be proposed right now and get everyone in the country insured over the next 10 years, it's going to cost between $1 or $2 trillion. In my hunch, as a conservative estimate, we can save $500 billion if we put this program into play with the focus on prevention. So how do we do that? Well, we're going to do prevention by showing people healthy eating habits and exercise. And that's going to be by setting up these clinics. Now, these clinics are going to be in every city and town around the nation as it's appropriate, or if it makes sense, maybe there have to be 3 or 4 towns that would meet in one center. The infrastructure is already available. The infrastructure for these clinics will basically be public schools. It can also be community education centers, maybe YMCA can help out, and any other buildings that would be available. So I do not believe that we need additional infrastructure. The second part of these clinics that are going to be talking about prevention will be healthy shopping. So taking the amount of money that a family has that spends per week on their grocery bill, they would be shown how to shop healthy. So instead of buying processed foods and foods with a lot of preservatives and fat and sugar and chemicals, etc., we're going to show them how they can shop for healthy fruits and vegetables with the same amount of money. Then we're going to show them how to take this healthy food, and that should be pretty easy to do, right? Then we're going to show them how to prepare healthy, quick meals. And this has been a key. As people have been watching this prior show that I did, and they come back and talk to me, they first ask, how are you going to fund this?